So the herd here at Woodford Farm is comprised mainly of older horses, the senior horses that are used for diverse research projects. We have a couple of younger horses. We have horses that have PPID or Cushing's disease, as well as horses with insulin dysregulation or equine metabolic syndrome. But then we also have a few horses that do not have any health issues, and they're also aged. They're also senior horses, and they serve as control horses. These are mainly thoroughbreds, which are not quite as prone to Cushing's maybe and metabolic syndrome as some of the other horses and some of the other breeds. We have mixed breeds here. Again, the thoroughbreds. We also have some quarter horses and some draft mixes as well. Given the fact that we do have a lot of horses with PPID or Cushing's here, we see often problems that can be related to that. These horses are prone to laminitis or founder. Luckily, we have this fairly well controlled here, so we're not seeing a whole lot of issues. We also have very good farrier services here as well. And so we don't deal with a lot of laminitis, but we see foot abscesses frequently. Occasionally, we see soft tissue problems with the tendons that also can be related to PPID, where the suspensory ligaments in the hind limbs break down or other tendons or ligaments just have weakness and break down. We see a lot of eye problems here, and that's fairly common in general in the equine population. We get the occasional infections that can be more difficult to treat in these horses with PPID since they are immune suppressed. And then dental issues in these aged horses. So horses have teeth that continuously erupt, and eventually as they age, they get shorter and shorter and they run out of the teeth. And so they cannot really grind and chew hay anymore. And so they need specific dietary changes to maintain them and to maintain their body weight. So maintaining their body condition is one of the things we really pay attention to, and that can be very difficult as they get old and they run out of tooth. They get a pelleted diet, or we soak the pellets. We can't feed them hay anymore, and so that's a big part of the management of the herd here. So I come through here every morning, and I first check with the farm staff here. They typically had already done the feeding in the morning, and so they had seen all of the horses, and they can tell me if there's an issue, any problems that they noted. So they keep a pretty close eye on them. They typically feed them twice a day. And if they notice any problems, they contact me, and I will go and have a look at that horse and then treat it as needed. It's a team effort. We have very good farm staff here that they do a great job looking at these horses, making sure that they're in good body condition. They pick up any issues really early. We have a great farrier system as well. We have really good farriers here that can take care of the feet. We have a dentist if we have advanced dental procedures. For example, sometimes these horses get EOTRH, which is a disease in older horses of the incisor teeth mainly. That's a very painful condition. So if we have to remove these incisors, we have a great dentist in this area as well. So it is truly a team effort, and everyone comes together to make sure that these horses are taken care of.